Welcome, welcome, Placido. Welcome, Gabby, representative from Baltimore County Executive Office. We're happy to have you with us today. So we're just going to go ahead and get started. We're really excited, as I mentioned, to have everyone here. Very excited to be doing this empowerment series, a mental health empowerment series, and partnering with Life Builders Church on just spreading information and resources, knowledge and expertise just around mental health awareness during this time. There's a lot going on in our world, in our society here in Baltimore City, Baltimore County areas. And so this has come at the perfect time, actually, especially right before the holidays as well. People are suffering, people are just trying to figure out what to do. They don't know what to do, and just trying to not only stay physically well, but also mentally well as we're trying to navigate everything that's going on in our social political climate, as well as with the COVID-19. And so we are Keys of Hope consultants, Lauren Capel and Tierra Sitnor Diggs, and we have partnered with Bishop Carrington, Charles Carrington, and Life Builders Church to have this 5-part series. And really is for us to raise awareness around mental health, mental health and wellness, as well as to equip our leaders, faith leaders, communities, families, lay members, whoever, with just tools of how to survive and make it through these challenging times. We're hoping that this series also gives people resources and the supports that they will need to help them to maintain their mental wellness or connect other families and people who you're associated with resources that are available in our area. So with that being said, I would like to turn it over to Bishop Carrington to do an introduction on behalf of Life Builders Church. I love how I see people coming and still introducing themselves in the chat. Please continue to do so. Thank you.
Good evening, everybody. This is Bishop J. Charles Carrington Jr. on behalf of my wife, my lovely wife, Pastor Althea, and the partners of Life Builders Church. I congratulate Lauren and Tierra and their wonderful ministry for all that they do. They rock. They absolutely got it going on, and they are very capable of what you're about to receive. They're capable of giving information. They're capable of not only information, but impartation. And while this is a countywide, citywide, worldwide, statewide, countrywide effort, I think I've seen some people from as far as California on this. I'm not trying to peep anybody, but a friend of mine from New Covenant Church in California is on the line. Some other men and women of God are on. So I'm happy that others from around the country have chosen to join us and will be joining us. I prayed for you all today because I knew that you all would be receiving something valuable. I knew that this would be the beginning of what it would take to strengthen us. I saw some of the partners of our church in my moment left kind of teasing me because of the topic of the message I ministered yesterday, which was sober up. And people thought that I was talking about alcoholism or whatever. And of course, I know during the message I put a big bottle of something on the table, and people got a good kick out of that. We're not talking about sober up in terms of wine consumption or any kind of alcoholic use or any kind of substance abuse. We're talking about sobering up our minds. The worst thing in the world that can happen is you lose your wit, is you lose your mind, is you lose your peace. And we want everybody, especially those that lead others, to be able to gather their hearts and their minds. The Bible talks very distinctly about a wounded spirit is hard to bear. And Delayed promises, make a heart sick. And we don't want leaders to throw in the towel. Because if leaders throw in the towel, where will the lay people go? Where will the people go? And if the people throw in the towel, then the leader's left alone. John Maxwell often says, if a leader doesn't have followers, it's just a person taking a walk. And we don't want any aspect of the combination of leadership and followership, of people in position to help and people that are in position to duplicate that help, to be worn down and to be worn out by the times. I also said on yesterday that we are in a season of pandemic. Seasons change. And I want everybody to realize that seasons change. And I'm praying that the equipping that you all will receive over the next few weeks will show you there is a light at the end of the tunnel. And we are going to come out better than we went into this. We're going to progress forward, and we're going to be better than we've ever been. So I salute you again, Lauren and Tierra. I look forward to the wonderful speakers that are going to be a part of this. And again, I say to all, welcome. Thank you for joining us today.
Thank you, Bishop, for that wonderful introduction. Hi, everyone. I am Tierra Sitnor-Diggs, and I'm also the co-director of Keys of Hope Consultants as well. I can't tell you how happy and grateful I am to be here this evening. My heart is overjoyed just to be able to share this moment in time with you. As Lauren and Bishop have said, this is the right moment in time, and everyone who is here, you should be here, just because, again, this is some great information to be able to put in your toolbox so that you can not only possibly use it for yourself, but also for the people who you serve in whatever capacity that you do serve. And so I just want to encourage everyone listening, looking, to just be present, to open your heart and open your mind, just for some really awesome information. I am truly pleased to introduce our first facilitator kicking off the series this evening, Miss LaShonda Godwin. If you give me a few seconds, I just want to share some wonderful information about this young woman who will be presenting to you this evening. Ms. Godwin is a licensed clinical social worker practicing in Baltimore City. She is also a writer, educator, sought-after speaker, and mentor in the field of social work. LaShonda began her social work journey in childhood. Growing up in the church fostered her love and inspiration for helping people to realize their potential and capacity for healing and wholeness. Always curious about the root issues that impact individuals, families, and communities, LaShonda dedicates most of her time working to understand the effects of trauma and social injustices. Over the last 20 years, LaShonda has engaged with folks from all different backgrounds, experiencing severe mental illness, domestic violence, sexual assault, structural oppression, and racial inequities. She is currently an adjunct faculty member at the University of Maryland School of Social Work, where she educates and mentors graduate students. LaShonda shares her expertise and passion for educating others through workshops and conferences on the topics of mental health, stress, and supporting groups and educating them in these topics. She attended Southern University of Maryland School of Social Work, obtaining a master's degree in social work. She has been employed by the YMCA of Annapolis and Anne Arundel County, the Housing Commission of Anne Arundel County, and most recently, the National Center for Children and Families in Washington, D.C., prior to her current work with families at the Family Connection Baltimore through the University of Maryland. LaShonda is passionate about supporting and strengthening families and communities. Without further ado, please welcome the wonderful Miss LaShonda Godwin.
Well, good evening, everyone. Thank you for joining us this evening to discuss such an important topic, mental health and wellness. Before I begin, I just really would like to thank Keys of Hope Consultants and also Life Bridge Church just for their partnership and their passion about spreading this information to folks who are in leadership positions in the church and lay persons as well. I'm very excited about tonight because I get to talk about something that is very important to me. And I'm also excited because I get to talk about this with folks that are also super passionate about helping others. And so a little bit about myself, in addition to what Tiara shared, is that I have been on both sides of the pulpit. I have also been on both sides of therapeutic services. So I provide services, but I've also had my own mental health challenges. And so tonight I want to be able to share with you the things that not have only just impact all of us, but have impacted me as well. So tonight we have some learning objectives. We have 4. So I hope that through this, through our discussion tonight, that everyone will be able to gain an understanding of mental health and wellness and learn factors that impact their functioning in these areas. Our second objective is to become knowledgeable about common mental illnesses and treatments. 3 is to learn how to recognize symptoms and support individuals with restoring mental health. And then our last but not least is discover how to make your congregation inclusive and welcoming for members with mental health challenges. So since March of this year, we have experienced multiple stressful life events. We can rarely engage in a conversation without mentioning the current pandemics that are related to health, related to structural oppression, and also related to our political climate. You may use the term that all of this is spiritual warfare, right? But how do we really define the impact that this is having on all of us? So in the last several months, there has been an increase in sadness, depression, and worry, irritability and crying, difficulty concentrating, changes in sleep and eating patterns, and avoidance of activities. And so these factors are deeply affecting everyone's mental health. So what is mental health? So let's talk about that a little bit first. So mental health includes our emotional and psychological and social well-being. It affects how we think, so it affects our thoughts. It affects how we feel, which is our emotions, and how we act, which is our behavior. It also determines how we manage stress and how we relate to others and make decisions. So our mental health can be impacted. And these are the 3 areas in which our mental health can be impacted. It could be impacted by life experiences, which pretty much, it's like things that happen in our environment that causes stress and trauma. Our mental health can be impacted through our family history, which maybe you've witnessed some family members that may struggle with addiction, or maybe have a difficult time processing grief. So that is, some patterns that maybe we have observed in our families. And then also our mental health can be impacted by biological factors, which just simply means that sometimes it's in our genes, right? That we have inherited a impact to our mental health. So sometimes we get more than our hair and our eye color, right, from our parents. Okay. So how do we know when our mental health has been impacted? So sometimes we see significant changes in our thinking, also in our emotions and in our behavior. And so when we also see that there is distress and problems that impact areas of our home or work and school and social life, when we see that these areas are being impacted, there's some source, right, or question that maybe our mental health is being impacted. So I just want to share with you how I realized during the pandemic that my mental health was being impacted. And I was having a very difficult time concentrating and focusing during work meetings. And this came about after learning about the murders of George Floyd and also Breonna Taylor. And so I really didn't understand why I was having difficulty concentrating during the meetings, because I thought I could just, I'm a therapist, I know how to take care of myself. And I thought I can just go ahead and just keep working along. But I really had to take some time and really reflect on what was happening during that time. And so I was very sad about a lot of things that were happening. And so that was really starting to impact, right, my thoughts and mostly my emotions around issues. So oftentimes when we're experiencing an impact to our mental health, we can cycle through what I like to call the 4 S's. And so the 4 S's are suffering, silence, shame, and stigma. So everyone is vulnerable to experiencing suffering. Suffering is a human experience that affects everyone. When folks think about the church, they think about healing, right? They think about a place where they can go when they are suffering, right? And so sometimes when we're suffering, we may think that we should suffer in silence, right? Because we don't want to share with anyone what is going on with us. And sometimes we don't even understand what is happening to us. But one of the things that I want you to think about is that silence, right, isolates and creates differences. So when you think about silence and not sharing, a lot of times folks think that nobody else is going through the same thing I'm going through. So I'm just going to suffer in silence alone, right? And then sometimes folks feel ashamed about what they're going through. They have feelings of shame. And so shame just really deepens the trench of isolation, and it increases the thought of something is wrong with me. So when I work with, and many of us who are in the mental health profession, when we're working with folks who are experiencing trauma, the first thing we want to ask them, or it could just be a very stressful life event, is what is happening to you, not what is wrong with you, right? Because when we ask that question, what is wrong with you, that creates this feeling, or could potentially create the feeling of shame within someone. And so a lot of times folks don't want to share or feel ashamed about what they're going through because of stigmas, right, that are associated when someone's mental health has been impacted and they're experiencing symptoms of a mental illness. So we want to try to encourage folks to really understand that suffering is a human experience. We're all vulnerable to it. And we don't want to perpetuate the cycle of suffering and silence and shame because of the stigmas that's associated with it. So just to talk a little bit about some of the mental illness stigmas and facts. So some of the stigmas is that mental illness is caused by weakness. A lot of times folks feel like, well, if I'm experiencing these symptoms, if I'm very, very sad, or if I'm very, very angry, or if I don't really have a lot of energy and I don't want to get out of bed, that maybe, I'm not spiritually, maybe I'm spiritually weak, right? Maybe I am not praying enough, or maybe I'm not seeking God the way that I should. But that's a myth. That's not true. Okay. The result, sometimes people think that mental illness is associated with the result of bad parenting. Sometimes folks think that because they raised their children a certain way, that now their children are experiencing mental health issues because of their parenting. Some folks think that mental illness is untreatable, or that maybe it's a divine punishment. God is punishing me for my sins or things that I've done. But that's not true either, right? That's a myth. And that also that mental illness causes folks to be, people who are having mental health challenges can be violent, and that's also not true. So some facts about mental illness that is very important for you to know is that it can be considered a disease of the brain. It's a little different from neurological disorders in the sense that mental illness can somewhat change, right, the structure of the brain. And so, but the thing to know about it is that mental illness is treatable. 1 in 5 adults in the US experience a mental health condition in a year. There is an 11-year delay between symptom experience and treatment. And this is very important to take away from tonight. The 11-year delay between symptom experience and treatment is a huge gap before folks even think about or consider talking to someone, right? It takes typically 11 years. So when you think about mental illness, you also need to think about what a physical illness, how would you treat a physical illness? So if you're having a pain in your chest or somewhere else in your body, you go to see a doctor immediately. Well, with mental illness, because it's something that sometimes we really can't see, it's more so around our feelings, our thoughts, and our behaviors. Sometimes we don't go and see someone right away. So that's very important. Violence is not always an outcome of a mental illness or a mental health condition. And a mental health condition can happen to anyone at any time in their life. So I'm going to talk a little bit about the common mental illnesses. And this is not for purposes of diagnosis. So I just want to put that disclaimer out there. So I don't want anyone to go around and say, oh, well, I think Sister So-and-so is bipolar, or, no, that's not what this is for. It's just for you to really have an understanding of some of the signs or maybe symptoms that is associated with common mental illnesses. All right. So we're going to talk a little bit about these, which is anxiety, personality, bipolar, depression, schizophrenia, ADHD, post-traumatic stress disorder, and also addiction and substance use. All right. So here you can see, so anxiety is what we feel when we are reacting to fear and or stress. So all of us experience some level of anxiety. But when it becomes excessive and it starts to interfere with our normal everyday functioning is when we have some concerns. So some of the symptoms that may be related to anxiety can be physical, psychological, and also behavioral. So sometimes it could show up physically in us by having chest pains or maybe rapid heartbeat, shortness of breath, headache, sweating, nausea, dry mouth, and also muscle aches. Psychologically, folks might worry excessively, have decreased concentration, irritability and confusion, and also feeling on edge or nervous. And so the way people sort of act when they're experiencing excessive anxiety might be to avoid or have hypervigilance, which means to be overly protective, and also may socially isolate. Okay, and personalities disorder. So there's several types of personality disorders, and also there's several types of anxiety disorders. A personality disorder is a person's way of behaving, of thinking and feeling that makes them different from another person. So it's kind of like, those characteristics that kind of make you stand out from someone else. So it also impacts someone who may be having a rigid or unhealthy pattern of thinking, behaving, and functioning, and they may have some problems with perceiving and relating to people and situations. So there's several types of personality disorders, but I'm just going to name 3 of them that you may be familiar with, which is antisocial personality disorder, borderline personality disorder, and also narcissistic personality disorder. So with antisocial personality disorder, folks really don't have a regard for the safety of themselves or others. And this is kind of where you refer to folks as psychopathic. Borderline personality disorder is characterized by unstable moods and behavior. Sometimes there's issues with relationships, and there may be some incidents of like self-harm or self-mutilation. And then narcissistic personality disorder is when a person has like an inflated sense of self. They really have disregard for others' feelings and a very inflated sense of entitlement. Bipolar disorder is relating to 2 extremities characterized by dramatic changes in a person's mood, energy, and thinking. Mania is when someone is experiencing a high mood, and then depression is when someone is experiencing a very low mood. And so bipolar disorder, there are 2 types, and there are several symptoms that folks may be experiencing. Manic symptoms could be increased energy. Folks typically don't sleep during that manic state. They also have a feeling of being invincible. They may splurge money, like go on shopping sprees, and really just feel like they have like unrealistic plans and ideas, thinking or speaking fast, exaggerated self-esteem. And then on the depressive side, some of the symptoms that a person experiences in a bipolar episode could be sadness, feelings of hopelessness, loss of self-esteem, excessive feelings of guilt and worthlessness, difficulty focusing and making decisions, and sometimes suicidal ideation. And we all know pretty much, maybe we all know about the symptoms of depression. I know I can say for myself that I have experienced bouts of depression where folks can seriously be affected in their thinking and their feelings and also in their behavior. People with depression typically have a lack of interest in activities that were pleasurable and low energy. And the thing to know about depression is that it can happen at any age. And when untreated, it can be, depression can be a risk for suicide. So a lot of, right now, when you just think about all the things that are happening and going on, folks are not able to do the usual activities. They're being isolated and having to stay at home. And so it's very important that we keep an eye on, folks that might be experiencing symptoms of depression. And we'll talk a little bit more about that later on. And so schizophrenia is a severe mental illness. It does affect a person's ability to think clearly, how they interact with others, their decision making. They're not typically violent, but there can be some psychosis that is experienced. And sometimes folks typically usually have a what we would consider a psychotic break in their early 20s. And so you might remember an example of some of the symptoms of schizophrenia from the movie The Soloist with Jamie Foxx, who played that character, you'll see that the person may have an impaired perception of reality and the ability to communicate, may experience delusions and hallucinations, and also characterized by like some disorganized speech and thoughts. And some may have an intense fear of being persecuted or victimized or mistreated. All right. Do we have I want to pause just for a minute to see if folks have any questions. I know I've said quite a bit. Any questions? And feel free, if you have any questions or thoughts you'd like to share, please feel free to put them in. All right. So attention deficit hyperactivity disorder, ADHD, which is a disorder that we all are probably very familiar with as well, especially when we're thinking about children. But this can also affect adults as well. So ADHD is characterized by inattentiveness, impulsivity, and hyperactivity. It is a neurodevelopmental disorder, and it's typically seen in school-age children. But ADHD may interfere with every aspect, right, of a person's life, and that's to include work, their social life, their school, and even their home environment. Sometimes ADHD could be misdiagnosed, and it's very important to think about what are some other symptoms or issues, right, the root causes of something when considering this diagnosis. And we'll talk a little bit about that, because sometimes folks could be experiencing post-traumatic stress disorder and be diagnosed with attention deficit hyperactivity disorder. And so when it shows up in adults, they may have difficulty like organizing, managing their time, their money, and their daily activities. So post-traumatic stress disorder is a mental health condition that may involve disturbances in threat perception and sensitivity, emotional functioning, and self-image. So PTSD can occur after someone has experienced or witnessed a stressful life event. People have different responses to stressful life events, and trauma can actually change the brain. So some things that folks experience when they do have post-traumatic stress symptoms is intrusive thoughts, memories, dreams. Sometimes these dreams can be nightmares or night terrors. They may also have a high arousal and reactivity to triggers. So things that remind them of the stressful event can really trigger them. And they could have a high reactive response to that. Most often, people experiencing post-traumatic stress disorder will avoid people, places, and things that remind them of the stressful event. And they also may have difficulty regulating their emotions around the stressful event. So one of the things that I think is important to mention here too is that if you think about, like, if you just imagine you walking in the woods and there's a clear path and you don't see anything, right? You're just walking along in the woods. Someone with PTSD, if they came across a bear in the woods, and let's say the bear was in a cage, right? They will still perceive the bear as a threat. Whereas someone who is not experiencing post-traumatic stress will see, okay, this bear's in a cage and it's not going to bother me. It's not going to cause me any harm. So that's another thing that is very important to know, that when folks are experiencing these symptoms, is that what they perceive as a threat to them may not look the same to someone else not experiencing that. Addiction disorders is a chronic disease of the brain, and it makes the person very compulsive. It significantly affects the brain and behavior, and people can become addicted to many things. So it's not just related to substances such as drugs and alcohol, but people can be addicted to gambling, shopping, eating, sex, and sometimes, like me, having the last word. Um, so that. So the next thing I want to talk a little bit about is suicide, because this is very, very important, and sometimes we can miss the signs of when someone might be experiencing suicidal ideation. So some things to know is that suicide is the 10th leading cause of death in the US. It's the third leading cause of death for ages 10 to 14 and second leading cause of death for ages 15 to 34. These are very young people, right, who are, based on these statistics, are considering suicide. And so I think it's very important to know that these are like also crucial developmental stages, right, in someone's life. We're talking about preteens, teens, and young adults. And so this is a time in their lives where they start to see themselves differently from what they may be perceived by their parents and extended family members, and even church members sometimes, who are also our extended family members, right? So we want to really understand the influence, right, that all of these factors have on young people. And so we really want to be cognizant of these signs that may be affecting young people. Men commit suicide 4 more times than women, and 1 million people attempt to commit suicide each year in the US. 37,000 people in a year in the US successfully end their lives by suicide. So this is something very serious that we need to pay attention to. So how do I know if someone is thinking about suicide, right? We can't read everybody's minds, but we know, right, folks' spirit. We know when something isn't right, right? So let's talk a little bit about that. So some signs of suicidal ideation is changes in behavior and mood. Folks will often talk about it or write about dying, and that could kind of seem odd to us. Feelings of hopelessness, helplessness, and worthlessness are also signs of suicidal ideation. Sometimes folks say, I want out, and there's no reason for living anymore. We want to explore this with folks. We want to know, what do they mean by that? Do you have a plan? Right? That's very important to follow through and to explore. Isolating from family and friends in the community. So we want to check on our folks, right? We don't hear from them, we don't see them, especially during this time, right? And where we have to isolate to maintain our physical health, right? So giving away meaningful possessions, getting affairs in order, and sometimes increased substance use can also be a sign of suicidal ideation. So some of the risk factors, So some of the risk factors that are associated with suicidal ideation are previous suicide attempts, losses and other events, and family history of suicide, exposure to others' suicidal behavior, and history of abuse and trauma. Chronic pain and also physical illness can also increase suicidal ideation. Sometimes when folks are in lots of physical pain, they feel like they don't want to be here anymore, and it's very difficult for them.
LaShonda,
Yes.
can you hear me? Hi. I had a quick question, and I wanted to know if you would possibly be able to share the extra layer that the pandemic itself kind of places on just the risk of suicide when it comes to our youth, when it comes to us as, older adults, even some of the older population. Would you be able to kind of share with some of our participants like what that may look like? Because again, sometimes, I share with people that, we can smile and still have these thoughts. We can still go about our daily lives and still have all of these thoughts. So just to kind of add just an extra layer to the onion, that you're so greatly peeling back. Would you be able to kind of spread some information about that? Because again, sometimes it can look different, and especially in a pandemic where we're not connecting or we're not connecting with each other, and we, as you said, for health purposes, we're isolating. What else are some things that these wonderful leaders can kind of be tapped into, especially during a pandemic?
Thanks, Tier. That's a great question. So I think connection is one of the things that you said is the key, right? We need to be connected to folks. I know that we are isolating. We all are isolating because of our health, but we need to find alternative ways of connecting. How do we check in with folks that we haven't seen or talked to? How are we continue to cultivate and build these relationships so that when we do see things that change in someone's thoughts or maybe change in their behavior, or maybe we're seeing some sort of action that they're doing that doesn't seem right to us, right? So I think connection is the key. How do we do that? So we're doing something right now, right? We're on Zoom and we're all connecting and we're building this community, right? To learn more about mental health. But how do we do this one-on-one? So checking in with folks, even if you send a text message, sometimes we can, or just picking up the phone to say hello, checking in with folks on a weekly basis, checking in with, sometimes folks might need to be checked in on a daily basis. Not to overwhelm us, right, with all of the other things that we have going on. But I think that's important. Connection is the key in these moments to be able to support folks who are feeling extra isolated because they're already living in the isolation of the symptoms that they're experiencing. And so we want to make sure, especially if we know that folks already are suffering, all right, or have had some mental health challenges, we want to make sure that we're finding ways to still connect during this time. That's so important. Did that kind of answer your question?
Yes, absolutely. And it looks like, thank you, Valerie. It seems that she shares that sentiment as well. So no, yeah. Because again, it looks different. It's easy
It does.
to look at someone and maybe pick up on some of these factors when you can see them. But again, because many of us are, in our homes a lot more. And like I said, it's easy to hide behind a text message. It's easy to hide behind an email. It's sometimes easy to hide behind a phone call. We can put on our good voice just to kind of get through. And so again, as people who do serve others, just some other things to kind of, again, think of the people that we work with as onions, and again, they're going to present their best selves, but sometimes it may take a little bit of digging, a little bit of pulling back some of
It
those
does.
layers to get to some of these factors so that, we can help and support the best way we can. So, yep, thank you for going a little bit deeper.
It certainly does, Tiara, and I like that you mentioned the fact that we do have to go a little deeper because sometimes, have you ever said to someone, or maybe someone has said to you, even in person, how are you? And then they keep walking because you're not really waiting to hear the response, right? So sometimes we really just have to sit, right, and wait for the response. Like truly ask someone, how are you doing? And wait for them to give you the response. And even when you're feeling like, oh, well, maybe, I don't know, it still seems like something just isn't quite right, right? Let's dig, we can go a little deeper and we can ask some more questions that don't and we need to ask them from a non-judgmental approach, right? So we need to be able to share with folks, I know that we may even share our own story about, our own vulnerability in this time and how we're getting through. And so that's another thing. Sometimes as faith leaders, we're concerned about sharing with other folks like some of our vulnerability. But then that is also a way for other folks to open up, to know and understand, they're human just like me, right? So
Yep, absolutely. And Stephanie shared as well, having more conversation like this with no judgment in a safe space is important. So again, I know you and a lot of your teachings, LaShonda, talk about brave space, safe space. And so to Stephanie's point, absolutely just having a discussion. And sometimes it's hard. But again, we have to have it. And yes, Valerie, transparency is absolutely key. So thank you both for sharing that.
Oh, I wish I could see all of the chats.
And I just kind of wanted to chime in with this as we're having a discussion, because we wanted to start this part off with just understanding mental health issues in general, because we've seen an increase in anxiety, we've seen an increase in depression, we've seen an increase in PTSD. And the post-traumatic stress, I mean, people have lost family members behind this virus. People are impacted by everything that's going on with the social injustices. So we are noticing the trend of an increase in cases where people right now just don't know what to do. And these people are in your family, they're sitting in your congregation, they are your church members, your brothers and sisters. So when we look at even losing your job, facing homelessness, all of those things, we're noticing an increase even now with suicide, that people don't have a way out, they don't see a way out, and so they're resorting to suicide. And I mean, since the pandemic, I've come across articles where pastors have even taken their life. And so it's important not to minimize what's going on, but it's almost like, I don't want to normalize it, but it's normal to have a certain feeling of depression and anxiety during this time.
Absolutely.
But we're definitely seeing an increase where it really is impacting functioning just across the board. And so I just wanted to highlight that, because there might be somebody on here that's struggling or trying to figure out how to help a family member or a church member or whoever during this time, and especially when we're all kind of going through it.
Absolutely. Thank you, Lauren, for using the word normalizing, right? Because I think a lot of times so that goes back to talking about the 4 S's and the shame, right? And the stigmas that's associated with mental health challenges. Another thing that's important to know is that sometimes mental health challenges can be situational. Like people can experience them just because of what is happening. So think about right now. So everyone, I believe, has somewhat experienced a mental health challenge. If you haven't experienced a mental health challenge, please call me and let me know what you're doing, because it is, folks are being affected tremendously by, like I said in the beginning, the pandemics. We're not just in one pandemic. We're experiencing multiple pandemics at one time. And so to say that you're not being affected by it, even just by a little bit, I don't know. We would have to have some more conversation, right? But suicide is increasing because of the things that are happening today. And one of the things that I want everyone to really take away from this as well is that we should, when someone says that they don't want to be here anymore, we need to take this seriously. When folks are exhibiting signs of suicidal ideation, we need to give immediate attention to someone expressing that. We need to share our concerns in a non-judgmental approach. Folks need to know that they're able to come and be able to talk to us. Explain how you can provide support. So, and when you explain how you're going to provide support, you have to know where the supports are, right? So it's very important to be able to know who are your mobile crisis centers and agencies, your local ones. How do you get emergency assistance? What does it look like? Supporting the individual and the family with walking through that process is also very important. And I know that that's difficult right now, like in this, this space where we're not one-on-one with folks, where we're able to do that. But there are ways in which you can do a three-way call if you suspect, even if you see someone on a Zoom call and they're expressing some suicidal ideation, or even on a phone call, explain to them the things that you need to do to be able to support them in that moment.
LaShonda, if I can chime in real quick, I think Bishop,
Sure.
did you have a question or a statement you wanted to make?
Yeah, I just wanted to really emphasize not what you said, LaShonda, Dr. LaShonda. I want to really emphasize how, as leaders, key leaders, how can I say this? Because I know the pain of what many of us are going through. I have a friend of mine on here, I think Pastor Brewer, not to put you out there, he had very devastating transition, and he's my friend, and I appreciate him. I think you're from Indiana, man of God. I think he's from Indiana. He's a friend of mine, and I remember reaching out to him, and we talked, and shared, because we both suffered something. The thing I like about him, and I want to just put his props out there, he wasn't ashamed to share his vulnerability as a leader. And you're doing this class, and I'm not trying to teach it. I can't beg leaders enough that we find somebody we can talk to.
Absolutely.
We try to put ourselves up on this pedestal, and so much. It's such a devastating thing when a leader takes their life. You leave so many questions. I mean, anybody take their life is devastating. But I'm talking about when a key leader decides to turn a knife, turn a gun, hang themselves, drown themselves, or whatever. Oh man, how many lives it just wrecks more than anything else. And again, I'm not trying to say leaders are more important than somebody's husband, wife, or child, or parent, but we're living in a time where it's such instability that when a leader says, I'm going to take myself out, that just sends ripples, I would dare say shockwaves, beyond the capability of many to deal with. So I'm just begging to piggyback on what you said, and I'm going to get back on mute and hide my wonderful face. I'm
No, you need to say that. That needs to come from you, and I appreciate you for saying that. Yeah.
Thank you. I'm begging. I really am. I am. Go ahead. I'm sorry.
Absolutely. Thank you so much, Bishop, for jumping in on that point, because it is it's extremely important, right? It's a life and death situation, and we need to move. We got to get past our shame, and we need to move in the area of vulnerability, where we're able to share and express the things that we're going through with one another. So I gave you the 4 S's, and so I want to talk a little bit about the 4 R's. Okay, so when someone is coming to us and they are open and they are sharing this information, we want to receive this information that is being provided to us with care. We want to be able to respect the individual and family privacy, right? So we want to support them. We're not going to go and share this information unless they give us permission to. But we're not going to just go and share this information with other people. This is their information. They're coming to you. You want to respond with empathy and attentiveness to the individual and family's needs. It took a lot for this person to open up and to share this information with you. And so when we think about resolving or helping to support, to restore, the remedy should be individual and family focused. So we want to collaborate with the individual and the family in our process for helping them to resolve and to remedy the issues that they're facing. All right, so what kind of agent or leader are you during a mental health crisis? Right, so we have the it's like Gecko, And we have Mayhem from Allstate and Jake from State Farm. And we got, I think her name is Flo from Progressive, right? So when you think about these characters and you see them on TV, right? So the gecko, he's really like, I'm not that unbothered. You know, he's like, I'm unbothered. I'm not really, I'm just here. You get 50% off, right? And then you look at Mayhem. And the slogan for Allstate is, you're in good hands, right? Are you that leader that's just kind of like, oh, I'm just unbothered. Yeah, we'll deal with it. Let's just pray about it. Or are you kind of like, you're good in my hands, right? Mayhem could come, anybody can come, I got you, right? Or are you that leader that's like Jake from State Farm, right? Who was at 3 a.m. sitting in his khakis answering the phone, right? Burning both ends of the candle, right? So I say that to say that we also as leaders, also as clinicians, also folks who are working in this field, we need to take care of ourselves as well, right? To be able to support others. Or are you like Flo? Flo is she just makes sure everybody gets what they need, even if she has to figure out who else can provide it. Maybe Progressive may not be able to do it, but I'm going to find somebody else that's going to help you, right? So you may be a mixture of all four. There's nothing, bad about any of them, right? They all have their ways of figuring out how to support people and keep them safe, right? So one of the things, so let's talk a little bit, but we do need to expand our network, right? We cannot, like mental health, the challenges, all these things don't happen in a vacuum, right? So we need support and help. And so one of the ways that we can expand our network is by knowing our resources. So psychotherapy is one of the things that really can support folks when they're experiencing a mental health challenge or crisis. And this is pretty much just talking to a trained professional about what is happening to you. This is a safe space in addition to the church to just share worries and concerns about their symptoms. And this could be done in traditional and non-traditional settings. I provide clinical services and therapy to families. Prior to COVID-19, I was going into their homes. So there's different ways that folks can receive therapy. Now, because of COVID-19, we've made a commitment to still connect with individuals and families, but we do it via Zoom. Folks can get individual and group sessions on therapy. And it's also important to know that you can collaborate with a trained professional to develop a plan to reduce and alleviate symptoms. So just because you're providing a referral and supporting someone with getting the help and support that they need, you also can continue to be, if the family wants that, right? You can also continue to collaborate and support the family through this process. I'm going to talk about medication briefly. I know that sometimes due to the side effects and certain things associated with medications, that folks may want to have some alternative ways, right, of alleviating the symptoms that they're experiencing. But it's important for us as faith leaders and as clinicians that we need to be open, right, to just hearing and learning and listening about the concerns that folks might have regarding taking medication. But some mental illnesses may require medication to reduce or alleviate symptoms. And it can support and lead in a successful life. So we don't kind of want to have a judgmental approach towards that. It's really what we want to listen and understand what is going to be helpful to the folks that we're serving. So there's some alternative methods to alleviating symptoms of mental health issues and challenges, and journaling, meditation, music, visual art, yoga, exercise, healthy, even just changing your diet. That was one of the things when I started to really experience symptoms of depression associated with the pandemics. Was I really started to look at my diet, change some of the things that I was eating, and that started to help to alleviate some of the symptoms. I saw very quick changes in my mood, my energy levels. Sometimes folks are just experiencing work-life balance issues. We're working too much. I even realized that even during the pandemic, I'm working more than I was prior to the pandemic. Every minute of my day is filled to capacity. And that's pretty much because I don't have to drive anywhere, so I don't take into consideration the time it takes for me to drive into the office. And so every minute of my day is really booked with work. And so sometimes sometimes we might just need some coaching. Sometimes we need to just think about and reflect on some of the things that we're doing and figure out what would we like to do next? What will help us to alleviate some of these? How am I doing on time? Because I don't have anything. I have a few more slides, but am I okay on time okay, I'll keep going.
Yep, I mean, we want to leave a couple minutes for more questions. I know
Okay.
we have a question in the chat that I wanted
Okay.
to pose. How do we help those who approach us with mental illness on the street or like in the supermarket? That was a question that's in the chat.
Yeah, so depending on what the situation is, right? So the first thing you definitely want to do is make sure that, you're safe and you're feeling okay to intervene, right? Um, and especially like if you have young people with you or children, you have to consider like you know, what that would look like and have some thoughts around that before you approach or intervene. But I think so one of the things you can do, depending on what the situation is, if you're able to talk with the person and able to kind of support them, because it really depends on where they're at. So in our field, we have what we call baseline of what a behavior would look like, and then how that escalates. And when a person gets to a point where it's escalated too high, at that point sometimes folks are really unable to intervene just by themselves, and they need some additional support. And I know that right now that is very sensitive. It's a very sensitive topic to ask for additional support, especially from police, right? So, we're really, really concerned about that, especially in the Black community. We when we call the police, are they there to protect us and help us, right? So one of the things, because in parts of the work that I've done where I've had to have the police intervene in a lot of situations, I would stay with the person if I could do that and even during the call, I would say, this person is experiencing a mental health challenge. And so before I'm prepping them before they even show up on the scene, I think sometimes that I know in situations that I've been in that has helped, but I know that we are feeling or probably feeling very sensitive around that. And so how do we really support individuals that are having a mental health episode or breakdown and having to involve the police?
And LaShonda, can I chime in for a second
Yes,
with
please.
that too?
Mhm.
And so also I would probably add, and I don't know if like some of the participants on the Zoom this evening. So I know just based off of my gift of helping people, sometimes people somehow are seek me out, like it's maybe something that I give off that they know that I am quote unquote a helper. And so even in those cases, because sometimes it may not be like a full on crisis per se, but I know that I've experienced just, waiting in line and people kind of start sharing a little bit about themselves, especially depending upon how long the line is. And you may have people who may bring up something really heavy. I've always been very um I'm surprised by what some people will sometimes share, complete strangers. But again, it goes back to the signs of the times where sometimes people are just, happy to see another human being and have that interaction. And so sometimes the mental health situation may come out in that way as well. And so even with that, it may not necessarily be a situation where you may need to contact the police, but just being aware of even the resources within your community, like the crisis hotline. So for those who are here in like Baltimore City or Baltimore County, both have actual crisis lines that you can call. I believe both operate on a 24-hour basis. So even no matter where you are, kind of also just have that in your back pocket, just to kind of be aware of just those resources, because again, sometimes they may not send out the police, but they sometimes have people who are licensed clinicians who will show up to the supermarket or the laundromat or in Target or in Walmart or wherever you are, where again, you may just be having a casual discussion with someone, and they may present some things that are a bit concerning, or you even may share that number with them. There's been plenty of times where, again, random people may have felt compelled to share something so heavy. And I've been able to say, have you ever tried calling, this crisis number? And they've been very grateful for that. So that's even another way that you can kind of just equip yourself when you are out in the community, that sometimes may not meet the level of needing a huge crisis intervention where the police are involved, but again, some intervention. And again, just knowing, as LaShonda spoke about, those resources in the community. And one great way is being aware of the crisis centers within your community, because typically they are 24 hours and typically they will have someone who will come and respond, or at least be a guiding voice to you to help that person.
Absolutely. Thanks, Tiara, for sharing that.
And can I just share something too? God bless everybody. This is Valerie. I'm LaShonda's mother.
My mama.
I thank God for what you're doing and reaching out and to the community and at large. And it's a overwhelming responsibility to reach out to the lost and those that are mentally challenged. And I just wanted to share something real quick. I know time is of the essence, but I thought about, I don't know if any of you were aware about a situation up in California where there was this mentally challenged person, and this couple approached him. He just kept babbling and babbling and babbling, but he had been missing for 20 years. He had lived on the street for 20 years. And it took the love of God for this person to approach him and just begin to ask him questions, just to try to understand what he was saying, just to give him some attention. And come to find out, there was a family in Georgia that was looking for him for 20 years. And what they did was they were able to connect this man that had been homeless for 20 years with his family back in Georgia, because they simply started a conversation with him. And so I was just thinking that just maybe by sharing, you see a situation and being led, and like Sean, like you were saying, and everyone was saying, Tiara, you were saying too also about, making sure that, you look into the resources. And that's one thing that I want to try to do, because that's where my heart is trying to reach out to those people who have no hope, who are just lost. But I want to make sure that I'm protected at the same time, and making sure that, they get the help that they need. And so that's so important that, that you have the information to be able to reach these people, and especially in the church, we're supposed to be the hospital, and during this pandemic, it's like, how do you reach these people now? So I'm so grateful for the information that's being shared tonight, and so I can, absorb and feed and meditate on all of this and begin to ask God how I should go about doing this in my community, So each of us in each one of our communities should be able to reach out, be able to get the resources. I think this has been very helpful. But I just want to end it with, that because of that person, the couple that reached out, they got them cleaned up, they sat them down, they got them something to eat, continued the conversation. And that's when they found out that he had family. He left Georgia looking for, a venture for a new, way of life, and thought he would be able to find it in California and end up homeless, no job or whatever, quickly. And he was out there for 20 years. So it's just the love of God. I feel that just by trying to pray, just pray about it, pray and with the the information, Sean, that you're giving out, coupled with that, I believe that we can, begin to start helping people. But just knowledge, just being able to have the information is also key. So I thank you for this time, and I'm going to give it back to Sean, because I can start talking, I won't get off. So, but I thank you. Appreciate all of you.
Well, I have to say, I love you, Mom, and I appreciate you so much and your wisdom and
Love
all
you
of,
too.
all of, and just I know I have some other family members that are in the audience as well. But my mom, when I think about what Tiara was saying, my mom is one of those people that could be standing in line, and for some reason, somebody will walk up to her and just start sharing with her. It's like she just is a magnet to folks who are in need, and that has just always been her. When I was younger, I used to say, she's always been like that. When I was younger, she used to always wave. She'd be waving to people. And I'd be like, Mom, they don't even see you. And she's like, they see me. They're going to know that I'm here, and I'm here to help and support and all of that. So thank you, Mom. So really quickly, because I know that we're drawing down on time. So just know that wellness, right? It's emotional, it's financial. There's so many aspects, right? And the spiritual is really important. There are also other aspects of what it takes, right, for someone to be whole, to be well, right? So the religious and spiritual role in treatment is to support folks is you want to have an unconditional positive regard. That's a huge therapeutic word, but that is pretty much what that means in a nutshell, is that when people come to you, no matter where they find themselves or what situation they're in, we always see the positive side of this, right? We don't want to enter into a situation where we're blaming folks for their situation or their circumstances, but we want to have an unconditional positive regards towards anyone that we come into contact with. And I think that folks in the church do that the best, right? We want to practice confidentiality. That is one thing that is really important. When someone comes and shares their information with you, we want to make sure that we hold it in highest confidence. We don't want folks to overhear to know what is happening to, what happened to Sister Johnson, or we want to practice confidentiality. We want to show empathy. We want to listen and understand actively, and we want to ask permission before even giving advice. A lot of times we really jump to telling folks what they need to do. But we want to ask permission. We want to ask, is it okay? Can I share this information with you? We want to visit at home and in treatment settings. So that's a little difficult to do right now. It's still ways to be able to do that. But if you're not feeling comfortable with doing that, I know that we have Just recently, I was working, because I also provide field instruction for students who are practicing and becoming social workers. And so we had a client that was in the hospital. We still reached out, but whatever means that we could. So we used the phone. And so we still continue to meet and have communication even while she was in the hospital. Pray for the individuals and families. We have that down pat. Help with concrete needs. Sometimes folks just really during a mental health challenge may need some groceries, or may need some cleaning supplies, or may need some support with utility assistance. If you're not able to provide that yourself, know the agencies in your community and resources that can support folks, because sometimes folks are really just stressed out by, especially now with the rent moratoriums and the utility assistance being in place, and these things about to be able to be ending in December, right? All of the talk about these things being lifted, that are these protections being lifted, and folks being evicted, right? Because they're not able to work, they lost their income, and they're not able to pay their rent. So sometimes just even helping someone to manage and navigate their basic needs, right, helps to support someone and can alleviate a lot of stress that folks are experiencing, and encourage connections to additional resources. So this is when you should provide a referral. When somebody is in immediate danger to themselves or others. So we're not going to wait for that, right? We're going to get involved right away. When someone is having a severe and emotional behavioral problem that pose a threat or safety to themselves or someone else, we need to get involved immediately. When the levels of distress and functioning become overwhelming and coping becomes more difficult than usual. And sometimes we could see, as we're trying to work with individuals and families, we see that the progression maybe is going to a place where they may need to talk with someone who is a trained mental health professional. Sometimes there may be some developmental issues or like delays, and maybe they may need some additional support. Sometimes folks are not progressing through the grief process in a way, and they may feel sort of stuck. And so they may be experiencing complicated grief. So that's another time when folks should be given a referral. If you don't see changes and symptoms in their home, their school, their work environments, their social life is being severely impacted, you want to support these individuals with making a referral. I think okay. Yeah. So how to provide a referral, make the referral, be prepared to give information to a mental health professional, provide reassurance of your presence and support throughout the process, even if it's a 3-way call or through a Zoom visit right now in these times, and follow up and stay connected. That is so important. One of the things that I've done throughout my work in various agencies, we don't just give someone a referral and say, here, take this number and call, right? We want to support folks with, maybe we'll do a 3-way call with you. That's best practice. Do the call with them, right? Be in collaboration. Let the person know that you're actually making a referral. We should not make a referral without folks knowing that that's what we're going to do. Even when we're seeking emergency assistance, we should be having that conversation with folks. So the process may not be easy when you're making a referral, but one of the things that, some of the things that I like folks to take away from this is how to manage some resistance. So remember, consider the difficulty in acknowledging a mental health issue. That can be very hard for someone to talk about. Recognize how stigma about mental illness may contribute to a person's resistance to treatment, and take into account they may have a past history with taking medication or receiving clinical treatment that may not have gone well. So you may want to explore that with them. And explore the religious concepts that may have been a source of resistance, because that does come up sometimes. and understand how hopelessness can significantly impact a person's level of resistance. And lack of support can also feed resistance. Okay, this is almost the last one. So really quick, one of the ways that we could create inclusive spaces for worship is begin with creating a brave space. So this goes beyond having a safe space. We want to have a brave space, and that brave space allows people to be vulnerable. It allows people to be able to take perspective on different issues and things that may be impacting someone. So we want to be open. We want to listen to understand, right? And not so much to respond. We need to learn about mental health and the impact of mental illness. What we're doing today, right? We want to have open discussions with your ministerial staff and your laypersons. Like this is very, like put that on your agenda, right? When you're having your leadership team meetings, and teach about this. A lot of times when folks feel like they're being preached at, sometimes they feel like they're being judged. So use an opportunity to have teaching moments with folks in your congregations. Apply a biopsychosocial spiritual model. So this incorporates just not the spiritual aspects of a person, but also what they're experiencing biologically and psychologically, right? So that includes the mental. And so know your community resources. Tiara talked about this earlier. We have to know what our community resources are, and we need to partner with them. Identify the mental health professionals in your congregations. If you have folks in your congregations who are able to provide support, you need to tap into them. You need to know who they are so that they can support you. Be intentional about letting folks know that they can get support from you. So you may want to put something on your website that says, we're opening to listening to folks who have mental health challenges, or however you want to, message that. But show folks, put it in your bulletin. Maybe you might want to start a life group at your church. But most of all, in anything that you do, be authentic about it, right? Be authentic. So here are some resources. I know that we have lots of different folks on the line who are not just here based in Maryland, but here are some national. So the Suicide Prevention Lifeline, NAMI, the National Alliance on Mental Illness. Psychology Today will help you to locate a therapist. Therapy for Black Girls is one of my favorites. So I had to shout them out. You can locate a therapist for Black women in anywhere in the country. Get to know your local mobile crisis response agencies. That is going to be very important. And those are those agencies that can come out. They're not attached to the emergency room at your local hospital or the police. They are agencies that have mental health professionals who are able to come out on the scene if someone is experiencing a crisis, do a psychiatric evaluation, also provide some sort of diagnosis, treatment, and all of those things to support someone that is having a crisis. And also get to know your local domestic violence and sexual assault agencies. That is also very important. Sometimes folks are very impacted by these issues, and that does impact their mental health and wellness as well. Right. So, any more questions? Hopefully we have some time to take some questions, and I haven't used all the time, but I want to thank you all so much for joining us this evening. I hope that everyone stays tuned and joins for each of the weekly sessions that are going to be covered. There's so much more in store. If you have any questions that you'd like for me to address, you can reach out to me at lemons.life.laughter@gmail.com. And again, I want to thank you all so much for having me here.
Thank you.
Thank you again. Thank you again, Ms. Godwin, for sharing your knowledge and expertise with us. Hopefully, we answered all the questions that was in the chat. And if anyone has any last questions that they want to ask, this is the time to do so. So I know we are over our time.
Sorry.
Oh, no, no problem. So again, this is a 5-week series. So we started this as a foundation just to give a framework and a knowledge of what to look for as people are experiencing just different signs, different symptoms. Next week, we have an awesome speaker. And next week is really about leadership. Is it leadership? Life and transitions next week, I'm sorry. It's going to be about just navigating grief, loss, and life transitions as we are here now. So join us next week. We have another awesome speaker to talk about how to navigate through grief and loss and transition next week. And Bishop, do you have any last comments? Well, we are logging off. Okay. All right, well, thank you everyone for joining us. Please share this series. If you really enjoyed this series today, please share with other people, any other faith leaders, family members, community members. If you really enjoyed and got some nuggets, we definitely want to spread the word. So I look forward to seeing everybody next week.